Flu cases are about to kick off, with emergency departments in New South Wales alone already seeing 400 presentations of influenza-like illnesses every week. But health authorities say those numbers are only going to get worse, and they're urging all Aussie parents to get their kids vaccinated, especially as they head back to school. For more, Dr. Michael Wright joins us now. He's a GP and president of the Royal Australian College of General Practitioners. Great to have you with us. So just take us through. New South Wales obviously is peaking at the moment, and a lot of presentations. Is that the same across Australia?
We're seeing that the surge is starting in New South Wales. So I suppose, to be honest, we've been pretty lucky so far this year, is that we've had pretty low levels compared with last year, but we certainly don't want to repeat that. But in the last week or two, we've started to see this surge in New South Wales. Cases went up by 40%, so detected cases. And as you mentioned, emergency departments are pointing out bigger surges in flu-like illnesses. Just
reading, last year was the worst on record, so this year isn't as bad in comparison. Is it too late to get vaccinated?
Absolutely not. And I think that's the point of this warning, is we now have the ability to have these alerts, and it's not too late to get the vaccine. Basically, everyone over 6 months of age is recommended to have it, but particularly people who are at highest risk is everyone over 65, Aboriginal people over 50, kids less than 5, and then also people with chronic health conditions like diabetes, asthma, heart disease, all recommended to get it. And really everyone is recommended to get it because it reduces your own risk as well as reducing the risk of you spreading it to other people in the community.
Reading about shocking cases in Europe, particularly over their winter heading into our winter. Super K was one of the strains of influenza that people were worried about. Does the vaccination cover that?
It does. And so what we've got in the latest vaccine for this year, it covers against 3 or 4 strains, including that one. So either the ones that are the most common or the most serious in the Northern Hemisphere.
And kids going back to school next week, obviously the spread could potentially be worse. You don't necessarily have to get a needle though.
No, so the good thing now is there is now a nasal vaccine that's available. So it was subsidised earlier in the season for kids under 5 in New South Wales and in some other states, and it's still available. So for kids, well, basically anyone who doesn't like getting a needle, but it's only recommended for kids under 16.
Okay, I might sign up for that one. Dr. Michael Wright, appreciate your time. Thank you.
Great with you.
Here's Nat.